People with thyroid problems can get great results now with cutting-edge evaluations and non-drug protocols. Hi, I'm Dr. Gary Smith. What do you do when you know you have thyroid symptoms and yet your doctor says your tests are normal? Or what if you're taking medications and yet your medications aren't working? What do you do? I know how you feel because I've had thyroid problems. My wife has had thyroid problems. My grandma, my mother, most of the women in my family have had thyroid problems. But those who did the appropriate protocols are better today. Everyone entering my office has the same 5 basic priorities that must be addressed. These are reasons why we get thyroid conditions. Number 1 is autoimmunity. 87% of the people who have a thyroid condition will have autoimmunity related to their thyroid. Number 2 is blood sugar regulation problems, even though they may be, the test may be normal. Number 3 is anemias. Anemias, especially a decrease in iron, even a borderline decrease, can be devastating to the thyroid. Number 4 is bowel and liver function problems. Number 5 is fat metabolism. Autoimmune is number 1 because it's so devastating and it's also the most common. It's attacking you. When it attacks the gut, we see things like Crohn's and ulcerative colitis. We see, in the case of the brain, we see inflammation. Then we see things like brain fog and memory problems and dementias and Alzheimer's. Again, we help these things. Autoimmunity and fibromyalgia are a lot alike in the sense that your immune system is attacking your body and there are several systems that are simultaneously breaking down. The medical solution is to use immune-suppressing steroids. These have side effects, among them being chronic fatigue. Thyroid disease is a metabolic condition. You can't drug your way out of a metabolic condition. Another thing that I'm seeing is wrong or incomplete tests. My patients will come in with stacks of tests. They'll be coming to me from Toledo Medical College, the University of Michigan, the Cleveland Clinic, the Mayo Clinic even. They've had, for example, metabolic panel of, say, 26 tests, standard IC, while I do 54 to 56 tests. The thyroid panels often include 2 or 3 tests. I do 10 tests. No gut function tests for infections and food sensitivities that have a strong impact upon thyroid metabolism. No adrenal stress tests. The way of the thyroid and the way of the adrenal gland, they work together. If one goes, the other one tends to go. Immune panels, very incomplete. I go from a few different angles looking at the possibilities of immune dysfunction. You can't just do one test and you know what is the problem in that area. Another thing is the right test with the wrong conclusions. If you do medical tests, medical lab tests are done and taken on a range of the general population, but functional lab testing is done only on healthy people. In other words, the standard is only healthy people. And that is our goal. What is healthy? Let's go for that. Okay? An example of that is TSH. 5.5 or greater for TSH, that's thyroid stimulating hormone, is considered hypothyroidism in the medical community, and I would entirely agree. But in the functional ranges, in other words, what healthy people have for their thyroid function would be 1.8 to 3. Between 3 and 5.5 is a wide range. Those are the people who have thyroid symptoms, but their doctor says your tests are normal. Thyroid is a breakdown of your metabolism, yet some people do get help from medications. For example, Synthroid will help about 10% of the people who actually need that. Okay? However, what it does is it has a side effect of eventually weakening the neuroendocrine system responsible for producing TSH. Last thing I wanted to mention in this category here is food sensitivities can lead to thyroid disease. I use Cyrex testing, which is nearly 100% accurate. Most people are not getting that testing done. We need to do that. You may be taking the wrong supplements. Harmful forms of iron, common in our food supply today. too much or too little iron, too much or too little iodine, for example, resulting in the worsening of your conditions. You can be helped. I don't care what others have said. Thyroid can be helped fairly quickly without drugs. But you need to get more information so that I can help you. Your health matters, you matter. Okay? So please fill out the information on the website so that I can send you a free DVD and workshop information to take the next step to get your thyroid relief. Thank you.